Floors create the bottoms of our homes, so it makes sense to use the term floor when describing this part of our body, as it is the bottom of our pelvic region. Unlike the floors in our homes, our core floor is made of 3 different layers of muscles and ligaments acting as the support network for all of your pelvic organs, including your bladder, uterus, colon, and rectum. Did you know there are actually 10 different muscle groups down there? Before we can train them properly, it's important to understand a little bit more about them. The first layer is superficial and is made of 3 different muscles. One of these muscles is responsible for helping to maintain erection during intercourse for both men and women. The second layer is comprised of 2 different sphincter muscles and supportive ligaments and soft tissue structures. The third layer is what most people are referencing when talking about that old school term, the pelvic floor. 5 different muscles make up this layer, and if you take a look at the muscles, they actually form what looks like a soup bowl. Each of these muscles have a slightly different responsibility. Some of them orient themselves in a more vertical position. This design helps to control forward and backward motions of the pelvis. Other muscles orient themselves in a more side-to-side position running. It is their job to help control the lateral movement patterns of the pelvis. The remaining musculature attaches from your pelvis to your tailbone and makes them work most effectively with rotational movements. The positioning and design of all this musculature allows them to quote-unquote turn on like a switch with the movement of the hips, pelvis, and spine. Movement that turns on the muscles most effectively occurs in all 3 planes of motion.